Do you ever wonder why someone would have the urge to pull out their hair? Whether it's their eyebrows, eyelashes, or even the hair on their head. In this video, we hope to provide you with a better understanding of trichotillomania. We will address what trichotillomania is, its diagnostic criteria, the complications associated with it, treatment options, prevalence, and various comorbidities.
The word trichotillomania can be broken down into tricho, meaning hair, tillo, referring to pulling, and mania, meaning excessive or impulsive behavior. It is characterized by excessive hair pulling that leads to balding. Individuals with this disorder cannot resist the urge to stop their hair pulling behaviors. Hair pulling occurs mostly on the scalp, followed by the eyebrows and eyelashes, and then the pubic region. Hair pulling can be both focused and automatic. Focused behavior occurs when the individual relieves stress through hair pulling, or the individual feels that the hair is out of place or not right. On the other hand, automatic hair pulling occurs without the awareness of the individual and can take place when they are bored, watching TV, or reading. In children, it was found to be primarily automatic and usually begins within the ages of 10 to 13 and lasts throughout their lifetime with symptoms appearing on and off. Using the DSM-5, a standardized classification system for mental disorders, psychiatrists can determine if the patient has trichotillomania depending on 5 diagnostic criteria. The criteria includes frequent hair pulling that causes hair loss, continuous efforts to stop or reduce hair pulling behavior, clinically substantial distress in social and professional life caused by hair pulling, hair loss or pulling that is not caused by another medical condition, and that there is no other medical condition whose symptoms more accurately describe the reason for hair pulling.
Patients with trichotillomania may also consume their hair once it's been pulled. This is known as trichophagia, which is the repeated consumption of hair after pulling and can lead to many complications, such as trichobezoars. Trichobezoars are masses of hair found in the small intestine or stomach from repeated ingestion. Some complications associated with trichobezoars include muscle obstructions, where food and liquids cannot pass through organs, and gastric mucosal erosions, where there is a loss of the internal lining known as the mucosa. Gastrointestinal bleeding, such as blood in the stool, sores in the stomach, and holes in the small intestine or stomach may also occur. Other complications from hair pulling include damaging skin if sharp tools such as tweezers are used, and permanent balding due to damaging hair follicles if trichotillomania occurs for many years.
Now let's move on to treatment options. The most common treatment for trichotillomania is cognitive behavioral therapy, called CBT. CBT focuses on helping patients recognize and change distorted beliefs that they may have regarding hair and hair pulling. A specific form of CBT used is called habit reversal therapy, or HRT. Key components of HRT include self-monitoring, such as tracking hair pulling behavior, awareness training, such as recognizing urges and resisting them, and stimulus control techniques, such as recognizing environmental cues that cause hair pulling. Pharmacological options are not as favored but can include olanzapine, an antipsychotic that helps combat disoriented beliefs regarding hair, clomipirene, an antidepressant that increases serotonin, which influences mood, and N-acetylcysteine, a neurotransmitter that regulates mood. Neurotransmitters are chemical substances found in the brain. N-acetylcysteine helps decrease compulsive behaviors by regulating neurotransmitters. So, how prevalent is trichotillomania? Characteristics of trichotillomania can be found in 0.5 to 2% of the population. It most commonly occurs in women. However, in children, the sex distribution is equal. It was also found to have a higher prevalence in patients over 50 compared to younger individuals.
Trichotillomania is a condition that has been identified to occur alongside other medical conditions, particularly those impacting one's mental health. Before going into further detail, let's define this concept, better known as comorbidity. In this context, comorbidity refers to the co-occurrence of more than one mental disorder in the same individual. Trichotillomania is associated with many comorbidities. The most common ones include anxiety, depression, and obsessive-compulsive disorder. Trichotillomania can often cause an individual to experience higher levels of emotional distress due to low self-esteem, leading to feelings of shame and embarrassment, which can also cause social anxiety. As a result, this can cause increased levels of depression and anxiety. Obsessive compulsive disorder is characterized by repetitive thoughts or behaviors that cannot be controlled. This is extremely similar to trichotillomania, which is a condition characterized by repetitive patterns of frequent hair pulling. This obsessive compulsive behavior is similar to that observed in OCD. We hope this video was able to help you better understand what trichotillomania is and how it impacts a person. Thank you for watching.